Good evening, all of you. Am I audible, Navanitan? Am I audible? Okay. Let us start with the prayer. Sit with your spine straight, closed eyes, observe your breathing. Fold the arms in front of the chest. Let's chant Om 3 times, followed by prayer to Patanjali. Om. Yogena chittasya padena vacham malam sharirasya cha vaidyakenam yopakarotam pravaram muninam patanjalim pranjaliranatosmi Abahu Purushakaram Shankachakrasidharinam Sahasrasirasam Svetam Pranamami Patanjalim Srimate Anantaya Nagarajaya Namo Namaha. Place the palms on your laps. Gently open your eyes. So today we are going to see about the gynecological problems and yogic practices. There are many gynecological problems which we may not able to cover in this 1 hour. So few problems we are going to see now and how yogic practices can be helpful in addressing these gynecological issues that we are going to see today. So let us get into the class. So these are the female reproductive organs. You can see the organs involved in female reproductive system. The ovary, fallopian tubes. There are 2 fallopian tubes and 2 ovaries. Uterus. Uterus is in between the bladder and the rectum. You can see the urethra and other reproductive organs involved. Briefly, we are going to see, not in detail. So see the structure, the important organs. So the vagina is a canal that joins the cervix to the outside of the body. We all know that it is the birth canal. And uterus or womb. The uterus is a hollow pear-shaped organ that is the home to a developing fetus. The uterus is divided into 2 parts, the cervix, lower part, and main body of the uterus. It is called corpus. So the corpus can easily expand to hold a developing baby. A canal through the cervix allows the sperm to enter during the intercourse. Ovaries. The ovaries are small oval-shaped glands that are located on either side of the uterus. The ovaries produce eggs and hormones. The fallopian tubes. My screen is visible, right?
Yes, ma'am.
Yes, ma'am.
Okay. So the fallopian tube, yeah, there are two narrow tubes that are attached to the upper part of the uterus and serve as tunnels for the eggs to travel from the ovaries to the uterus. So this is the brief introduction about the reproductive system and the organs involved. Now let's get into what are all the problems that women are facing. Some few problems which women are facing during menstruation or other menstrual related disorders. This one is dysmenorrhea. Dysmenorrhea is the menstrual cramps. During menstruation, the women can experience a severe cramp. It is some female, not in all, but some, they may feel very severe cramp. There may be a mild cramp in some female, but in this dysmenorrhea condition where the menstrual cramp can be very severe, where they will feel like throbbing, aching cramps in lower belly just before and during period. So it will be very severe during period. So what doctors say, it will be stopped entirely after the delivery of the first baby. This dysmenorrhea, if it is present in the young girls, after their delivery, the first baby, it may entirely stop. But before that, they have to undergo the menstrual cramps. So the symptoms when they have the menstruation, they may feel, along with a severe menstrual cramp, they may feel nausea or sensation of vomiting, and it could lead to vomiting also and diarrhea. They may have headache and dizziness and severe pain in the lower back, thighs, in the lower belly including. So the causes, it could be due to endometriosis, a condition in which the tissue lining the uterus grow outside of the uterus. And then it could be due to fibroids or adenomyosis. Adenomyosis where uterine lining grows in the nearby muscle. And pelvic inflammatory disease, it could be due to infection caused by bacteria. And cervical stenosis or narrowing of the lower part of the uterus. So what happens in menstrual cramps is that it contracts too strongly during menstrual cycle. The uterus contracts very severely and it can press against nearby blood vessel. So this constriction stops the blood flow to the area. When the blood flow is stopped, the oxygen supply is stopped. So that is what causing severe pain in the uterus during the menstrual period. It is because of the lack of blood supply, which prevents oxygen, that leads to feeling heavy pain in the uterus during menstrual cycle. Women who exercise regularly often have less menstrual period. It is said, even the doctors, they recommend routine exercise to avoid this pain. We will see how yoga helps for this later. Before that, we will see what are the other conditions involved before we move to the yogic practices. This is recommended by the modern medicine, the exercise. They themselves recommend it to do exercise to come out of this dysmenorrhea. The another condition is menorrhagia. Menorrhagia is the medical term for menstrual periods with abnormally heavy or prolonged bleeding. So some women, they may experience this abnormal period where it may be for many days or it may be very heavy. This is in most of the cases, it will not lead to severe enough. If it is severe enough, then they have to, severe enough in the sense, if it is too heavy, then they have to take the doctor's advice. They have to visit the doctor. If it is not able, they are not able to manage, because it may lead to anemia. If it is too heavy, then it may lead to anemia and other severe complications. So in menorrhagia, not able to manage, then we have to take doctor's advice. There is another one, polymenorrhea, where prolonged heavy bleeding. Normally, it would not lead that much severe, but in some condition, if it leads to very severe, then medical advice would be needed. So the causes of this could be because of hormonal imbalance, fibroids, miscarriage, and other forms of abnormal pregnancy. Again, pelvic inflammatory disease and tumors. These could lead to this menorrhagia, where hypermenorrhea, where the bleeding would be very heavy. So the symptoms, they may need to change the sanitary pads. Many sanitary pads they may need as the flow is very heavy. They used to, the diagnosis, they will take a pap test, blood test, all that to find out what is the underlying cause in modern medicine. So the another condition is amenorrhea. Amenorrhea is the absence of menstruation, or often defined as missing one or more menstrual period. So what could be the symptom? Hair loss could be the symptom, headache, vision changes, excess facial hair, pelvic pain, acne, or the symptoms of amenorrhea. Amenorrhea is absence of menstruation. It could be for 1 or 2 periods. The causes for amenorrhea: pregnancy, breastfeeding, menopause, use of contraceptives, medications. If the body weight is too low, then it could lead to amenorrhea, or excessive exercise. Suddenly you start exercising too intensely. And then stress, again hormonal imbalance, and sometimes structural problems in the uterus or in any of the reproductive organs. So we are briefly seeing what are all the conditions, few conditions, and then we will see the yogic practices. Polycystic ovarian syndrome, this is very common these days in young girls. It's also again hormonal disorder, common among women of reproductive age. Women with PCOS may have infrequent or prolonged menstrual periods. They may not have period, and suddenly they'll have. So it will be very irregular. The ovaries may develop numerous small collections of fluids, which is called follicles, and fail to regularly release eggs. The exact cause of PCOS is unknown. Early diagnosis and treatment, along with they'll put on weight in PCOS. So weight reduction is needed. Otherwise, it will lead to developing other complications such as type 2 diabetes and heart disease. So the symptoms of polycystic ovarian syndrome, as mentioned earlier, the period will be very irregular, infrequent, and it may be prolonged cycles. Excess androgen, elevated levels of male hormones may result in physical signs. They may have facial hair, excess facial and body hair, which is called hirsutism, and occasionally severe acne and male pattern baldness. Polycystic ovaries might be enlarged and contain follicles that surround the eggs. As a result, the ovaries might fail to function regularly. The causes for PCOS, as already mentioned, is not known, but the factors may play a role, which is heredity. So if certain genes is there in a girl, particular genes, then they may develop PCOS. And excess androgen secretion. The ovaries produce abnormally high levels of androgen that will lead to hirsutism and acne. So let us focus on yogic practices. So the few diseases that we covered is, first one is dysmenorrhea. Dysmenorrhea is a very painful menstruation. During menses, women or girls, they may undergo severe cramps. This is dysmenorrhea. These are the symptoms of dysmenorrhea. They may feel dizzy or feel like vomiting, and they may face diarrhea also, and very severe pain in the lower back. Generally, we have a pain. We may have pain in lower back thighs, but in dysmenorrhea, it will be severe along with the lower belly pain. Causes we discussed. So fibroids, endometriosis. If you see that the hormonal imbalance in all these problems, the hormonal imbalance play the major role. So doctors recommend to go routine exercise to come out of this dysmenorrhea symptoms, to manage dysmenorrhea. Menorrhagia is heavy bleeding during menstruation. Some women, they may have excessive severe bleeding. So that is menorrhagia. If the bleeding is very heavy, then unprolonged, serious enough, then they have to go to doctor, because too excessive bleeding may lead to anemia, which may lead to other severe complications. So if it is manageable, we can wait. Otherwise, take doctor's advice. Polymenorrhea is the prolonged heavy bleeding. These are the symptoms we discussed. And then amenorrhea. Amenorrhea is the absence of menstruation. Mainly, if anyone suddenly they start exercising, they want to go for weight reduction, and they start to exercise very severely suddenly, or any athletic performance, the girls take training to go for athletic performance, then they may face this amenorrhea. And low body weight also. If the nutrition level is very low, then that may also lead to amenorrhea. And another condition, polycystic ovarian syndrome. It is a hormonal disorder, where in this they may have infrequent or prolonged menstrual periods. The cause is unknown. So now let's see how to approach with yogic practices. So we have to understand, in all the disorders that we discussed now, the hormonal changes plays the role. The hormonal changes, along with that, the fibroids playing the role. And when it comes to emotional imbalance, the underlying cause could be the stress. So stress leading to hormonal imbalance can lead to the problems in the menstruation. So how yogic practice is helping? So when it comes to stress and hormonal imbalance, we are very aware that yogic practices are very helpful in reducing stress and bring balance in the hormones. So when it comes to menstruation, it is that we have to practice regularly. When it comes to hormonal balance, it is the inversions. Inversions are very helpful bringing back hormonal balance, but the inversions has to be practiced not during the menstruation. So it is not recommended to practice inversions during menstruation. So other times they have to give priority to inversions. Inversion has to be gradually taken into. So Viparita Karani, Halasana, Sarvangasana, all these are very helpful when balancing the hormones. So hormones secreted by the ovaries and the pituitary gland, that they both play the role when it comes to imbalance. So when managing the hormonal balance, the Sarvangasana, Halasana, Viparita Karani, all are very good. That has to be routinely practiced, not during period, other times. Regular, consistent practice will help bring the hormonal balance. And for stress reduction also. So stress reduction, all other asanas can be performed along with pranayama and meditation. And the Baddha Konasana, Upavishta Konasana are very, very useful when it comes to menstruation related problems. We are all very familiar in yoga field that, during pregnancy, the Baddha Konasana, Upavishta Konasana are very, very helpful. So not only during pregnancy, these asanas practiced other times tones the pelvic floor muscles. So the toning on the pelvic floor muscles is very important because the uterus is situated in the pelvis. We all know that. We've seen in the first figure that the uterus is placed in the pelvic floor. So working on these muscles are very important in working on the menstruation related problems. So Baddha Konasana, Upavishta Konasana, and the asanas like Trikonasana, Parshva Konasana, Prasarita Pada Uttanasana, they open the pelvis. They stretches the inner thigh muscles, the groin muscles. When these are nicely stretched in these asanas, it helps to tone the pelvic muscles and it helps bring good blood circulation to the uterus and ovaries. The reproductive organs get good blood circulation, and twisting are also helpful when bringing good blood circulation to the reproductive organs. And Yoga Nidra, so Savasana, Yoga Nidra are very helpful in managing the stress. So Pranayama, Ujjayi, Anuloma Viloma are very helpful. And Mudra, this Ashwini Mudra is very, very helpful. The doctors, they may recommend to go for Kegel exercise to tone or work on the pelvic floor muscles. They recommend the Kegel exercise. It is same like Ashwini Mudra. We call it Ashwini Mudra, where this practice Kegel exercise is the recently developed, but we have this Ashwini Mudra from ancient times onwards. This Ashwini Mudra is very, very helpful in toning the pelvic floor muscles. And Moola Bandha. So practice of Moola Bandha, Ashwini Mudra, along with the asanas that we seen are very, very helpful to work on the pelvic floor muscles to bring good blood circulation, toning effect to the uterus, ovaries, all these things. And meditation and mantra chanting all are helpful together to work on the reproductive organs. So we are going to see now how to, and not only that, during menstruation also we can do few of the modified forms of asanas like Baddha Konasana, Upavishta Konasana. All these can be practiced even during menstruation, but proper usage of the props is recommended. So doing it without straining the organs. When a woman is menstruating, we are not supposed to strain the organs, but we can do the asanas using the props, which will not strain the organs, but it enhances, facilitates the free flow of the unwanted material from the uterus. So Divya, are you ready, ma? Navanidan, allow Divya to open.
Yes, ma'am. Ready, ma'am.
Yeah, open her video.
Yeah, ma'am.
Yeah, 1 minute with you. Okay. Yeah. So you can do the Trikonasana using the block against the wall. So all these asanas are done using the props. So Trikonasana against the wall. Why do we do against the wall is that when we do against the wall, the strain in the asana is reduced. If you do independently, you need more energy to maintain. You need the muscle. Wait, Divya. I'll give you instruction. So doing independently, you require more energy. That you may feel tired quickly. So doing with the wall support, you can maintain the pose for long time. So maintaining it is needed for the asana to work more organically. Here our focus is to work on the reproductive organ. So maintaining it for a few seconds at least brings good blood circulation to the area. If you go and come up immediately, we can't work that much to bring good blood circulation to the reproductive organ. So we need to maintain in the asana, but at the same time, we should not strain our body while maintaining the asana. So doing against the wall help us to achieve the purpose. Yeah. So the spine is, yeah, open the legs apart, feet parallel, feet parallel. Yeah, turn the right foot out. Left foot slightly turn forward. Left, yes. So place the brick behind the right foot. Yeah. On exhale, place the palm on the brick. Keep the brick word. Inhale, open the arms. Exhale, yeah, move laterally. Exhale, move laterally. Place the palm on the brick. Place the brick vertically. Yes. The upper arm can be stretched, or she's supporting it with again on the wall. So supporting it on the wall gives good support for your entire body, and the spine supported against the wall also helps you to maintain the pose at the same time, not feeling strain in your body system. So you can try this at your place. Try doing it against a wall. So maintaining here, you can see it has opened the pelvic area. So it opens the pelvic area and inner thigh muscles. You can feel a very good stretch, the groin, and it nicely stretches, works on the uterus also because of the geometrical shape of the body. You can see that the pelvic organ here is nicely laterally stretched on the left side. Inhale, come up, do it on the other side. You can still modify this. The upper arm can be folded. Keep the upper arm folded and placed on the hips. Yes. So still making it more comfortable, you can fold the upper arm and you can look down also. Therapeutically, if you, simplified action is where you can look down, place the upper arm on the waist, and even you can place the arm on a higher support also. If still this you feel strained, you can place a chair instead of brick. You can place a chair or stool where you have more height here, so that you can feel comfortably at the main time maintaining in the pose. So normal breathing. Once you are in the pose, you are not supposed to hold the breathing. Normal breathing here with focus on observing the stretch in your pelvic organ. Inhale, come up. Exhale, bring the arms down. So Parshva Konasana. Place a stool under your thigh. Do you have this stool? Yeah.
Yeah, just
See, the purpose here is maintaining few seconds in the asana so that the blood circulation is facilitated to the required area. So place in Parshva Konasana, rest the thigh on the stool. Divya. Yeah. Parshva Konasana, the thigh can be rested on the stool. If the stool is highest, then leave it. See, you do Parshva Konasana against the wall. Do Parshva Konasana against the wall.
sorry, ma'am, 1 minute.
Oh, yeah. So keep the brick, Priya. Divya, keep the brick for your palm resting. So the leg on which side the thigh is folded, you can keep a stool under the folded thigh. This leg, knee should not bend, Divya. This leg, yes, don't allow it to bend down, yes. So the folded leg thigh, under the thigh where the leg is folded on the right side, there can be a small stool can be placed under the thigh so that you can maintain in the pose for long. This is a challenging pose. So wall support also can be helpful. You can keep the back against the wall, fold the upper arm, Priya, Divya, upper arm and unfold it, keep it on your waist, keep it on your waist. Yeah, you can look down, you can look down. So this all strains, removes the strains in your neck and your arms, and the focused works here is on your pelvic organ. So work more on your legs, don't bend this knee. Yeah, come up, relax and come up, Divya. So on the folded leg, a small stool, you can place it so that you maintain in the pose. Otherwise, this is challenging pose. Yeah. So that one can be kept under the, keep the brick on it so that you have, yes. No, horizontally. So that much leveled stool can be used to main, yes. So as the focused area is pelvic, you can rest the arm on the waist and look down. Keep this leg straight, don't bend it. Yes, normal breathing. So this one, while doing this Parshvakonasana, be more careful. If person is having knee strain or severe knee pain, this pose should be avoided because this is contraindicated for knee pain. So you can see in this pose that how much opening has happened to your pelvic area. Nice opening of the pelvic area, and it brings good stretch to your inner groin muscles. The inner thigh muscles are nicely stretched. So it helps to work into the reproductive organ. Come up, Divya. Do Prasarita Pada Uttanasana. In the front, you can rest the arms onto the chair. Prasarita Pada Uttanasana. Chair, place the chair or stool. Ardha, half. Yeah. So nicely, widely open your leg. Feet parallel. Exhale, bend forward. Here, concave back. Yes. So head rested down, arms supported. The concentrated work on the legs and the pelvic area. So nicely keep the leg muscle stretched. Outer edge of the feet, press it down towards the floor. Normal breathing, don't hold the breathing. So this way you can maintain the pose as the arms is supported. Another way can also be done. Rest your head onto the chair, stool, Divya. Bring the chair, stool towards you and rest your head on it. Yes. So resting it, you can maintain for long time. As your spine is supported while resting the head, you can maintain in the pose for longer period than normal. The arm is also supported, the head is supported. This one can be done even during menstruation, but you should not strain. You can keep the back supported as well. The back of the feet can be against the wall so that the leg can be supported, head supported, arm supported, can be done during menstruation. But again, the caution here is don't strain the lower abdominal area. The lower abdominal area has to be completely consciously relaxed. While being in this pose, relax the lower abdominal area consciously because we tend to contract this area. So be more conscious not to constrict the lower abdominal area. So fully supported Prasarita Pada Uttanasana can be done during menstruation also, as it helps bring out the unwanted stuff easily. It is naturally we are facilitating the action of the uterus. The uterus want to push out the unwanted thing. So we are facilitating this through this pose with the caution, not straining our reproductive organ. The reproductive organ are already under strain. You relax, Divya. You relax. So during menstruation, the reproductive organ, mainly the uterus, is under strain to push out the thing. So at that time, we are not supposed to strain again. So we have to relaxly do. Mainly the lower abdominal part has to be completely relaxed. If this helps to relieve the cramp and also relieve the lower back pain. No, we may be having lower back pain during menstruation, thigh muscle, lower back, all this we may be feeling painful. So this one helps to relieve the lower back pain, thigh pain, all these things, provided that while doing you are not constricting or contracting your lower abdominal area, relaxedly doing it with normal breathing. Yes, Baddha Konasana, do Baddha Konasana. Sitting on a support, Divya. Sit on a support. So you can sit on some firm support. You can increase the support as needed, because during menstruation, the low back may be under strain. So sitting on support helps to relieve the low back strain. So you can sit on a support as much needed for you. You know, it is not standard how much support is needed. Some may need minimal support, some may need more support. It depends on their low back health. So if more support need be, you can use more blankets to sit on. It has to be firm, not cushiony one, firm blanket to sit on. So sitting on a firm support, try to take the knees closer to your perineum without this can be done even during menstruation. As mentioned earlier, the lower abdominal part has to be consciously relaxed, not constrained. So you can sit against a wall. So sitting against a wall, it gives support to your lower back and the entire back, so that you don't strain your lower back or other organs. She is not sitting against a wall, so you can sit against a wall, so that you maintain in the pose for a longer time.
Shall I sit against the wall now?
Yes, sit against a wall. And lift the arms up. Lift the arms up. Can you hold on to the sides of the wall? Yeah, support it. Yeah. No, keep it above the head. Yes. So if possible, you can do against the window grill, where you can use a rope or some strap to keep your arm lifted up. This way lifting up helps to lift the uterus, so that the abdominal organs not compressing against your uterus. So this way lifting your trunk up can help to lift your uterus. That gives good stretch and brings good blood circulation. So again, the arm has to be supported. You can do this against a wall and window grill. You can put some dupatta or something where your arm can be holding on to the dupatta or some rope. You can lift the trunk up. The trunk lifting up is very good for the uterus, because it gives space for the uterus. Otherwise, the abdominal organ always in compression on the pelvic organ. So this way we can give some lift to your uterus. Yeah, relax, Priya. Open the legs out in Upavishta Konasana. So all these asanas can be done during menstruation, provided you are not constricting your lower abdominal area. Keep the lower abdominal area relaxed. Here also you can lift the arms up, so that the trunk is lifted up. The lower back should not arch much. That will give strain to your lower. Yes, the lower back should not be arched much. Or you can bend forward, resting your head on some support. Not complete forward bend, Divya. Take stool and rest your head on that. Divya is our MSc Yoga Therapy student. Thank you, Divya, for helping me to explain these asanas. So you can still bring it closer. Bring it closer. No, Divya, bring it closer. See, in during menstruation, you are not supposed to do a complete forward bend, because doing complete forward bend will give compression to your lower abdominal area. So you can do head resting on some support so that there is no strain on your lower abdominal area. So as I mentioned, the ideal would be to stretching the arms up and be in concave back. Divya, concave back. No, keeping it closer to your body, keeping it closer to your body. Yeah. So yeah, you can even chin rested. Chin can be rested. So if it is hardness you feel, you can place some towel or something, to feel cushion there. So lift. So here you try to lift the trunk up. Yes. So lifting the trunk up, resting your chin on it helps your spine to stretch upward. So that way also it releases the strain from the pelvic organs. Normal breathing, you can maintain here with normal breathing. Feel the stretch in your inner thigh, the groin muscle. Do exhale, extended exhale. You can do exhalation, long exhalation, normal inhalation, extended exhalation. Consciously relax your lower abdominal area. Don't constrict there. Yeah, normal breathing. This you can maintain for a few minutes, as this is completely supported pose. Can be done even during menstruation, or other times if you want to work on the menstruation related issues, you can do in the evening before going to sleep. You can do for relaxation. This releases the strain from your reproductive organs. Yes, relax, Divya. No, for pregnancy and all, if girls or women is preparing for a pregnancy, they can do this before pregnancy in the evenings to work on the pelvic organ. The pelvic floor muscles nicely get stretched, blood circulation is enhanced, the pelvic floor muscles are nicely worked on for having a good pregnancy. So this is as a preparation also you can do, or even during menstruation to relieve the menstrual cramps we can do, and to address many issues like PCOS we seen. For all these problems we can do this, and we have to do with supported you can maintain for long time to work to bring good blood circulation to your reproductive organs. Ardha Machindrasana, Divya, with brick, have the brick for the palms to rest. So Ardha Machindrasana not to be practiced. Any twisting are not supposed to practice during menstruation, but other times doing this helps in working on the ovaries and the uterus. Intense twisting poses should be avoided during menstruation. Ardha Machindrasana with the one leg stretched, modified Ardha Machindrasana. One leg stretched, yes. So this way you can work on the reproductive organ. You can see that on the twisted side, a nice intense twist happens to your lower abdominal area. Sit on a brick, Divya. Brick or some blanket or something, any support. So sitting on some support relieves the lower back. At the same time, it gives more revolving action in your lower abdominal area. So as much revolving action you give in the lower abdominal area, it nicely brings the squeezing effect to your reproductive organ. So now the reproductive organ is in squeezing mainly on the ovaries on the sides of your pelvis. On the sides, the ovaries are there. So the lateral walls of the ovaries are nicely stretched in this twisting asanas. So releasing it, while releasing, it brings release the pose, Divya. Relax. So while releasing, it brings good blood circulation to the ovaries as well to the uterus. Even standing twist, all that can be performed. During menstruation, the supported asanas like Baddha Konasana, Upavishta Konasana, all supported, back supported, head resting on front, not too much compressing on the lower. During menstruation, any of the asana should not compress your lower abdominal area. More relaxation has to be given to the lower abdominal area. The stretch is only on your groin and the inner thigh muscles. In Upavishta Konasana, all these things, you are not constricting the area, but you are consciously exhaling. So long exhale helps to relax the lower abdominal area, keeping the stretch, which releases the lower back pain, other menstrual related pain. So we seen in dysmenorrhea, why we get dysmenorrhea? It prevents the blood circulation to the uterus. When oxygen is prevented, then it leads to cramp in the uterus area. So here we work to facilitate the good blood circulation to the uterus in yogic practices. So same Mahamudra, do Mahamudra, Divya. Mahamudra is a very good pose for working on the menstruation related problems. Strap, using strap, hold with the strap. Side profile, turn. So you can hold with the strap. So while holding with the strap, there is no much constriction happening in your lower abdominal area. Sit on support, sit on a blanket, Divya. Blanket or some support. So concave back, you can hold wherever you want to hold without straining the area. Nicely arch back. No forward bend, Divya. No forward bend. Concave back. Yes. With the Jalandhara Bandha. Back of the spine extended. Yes. Front in Jalandhara Bandha. Concave back. The spine has to be nicely extended upward so that you lift the front of the portion. The front of the abdominal area is not compressed. It has to be lifted up nicely. So this comes with the practice that you do on a daily basis. You know, in a single day, you won't get it. On a daily basis, you do these asanas, then it works on the reproductive organs, the Mahamudra, Ashwini Mudra, Jalandhara Bandha, Viparita Karani, Sarvangasana, all these has to be done not during menstruation, on a regular basis to work on our the gynecological related issues in yogic practices. Naswini Mudra is wonderful, and Moola Bandha can be done not during menstruation. Other time Moola Bandha is very, very helpful. Moola Bandha along with Ashwini Mudra works to tone on the pelvic floor muscles. Yeah, relax, Divya. So in standing asanas, pelvic opening has to be focused. In seated also the same, giving much rest to your lower abdominal area, keeping concave back of the spine, extending the work here. And backward bend also can be done. So other times backward bend nicely stretches the uterine wall. The uterine walls get nicely stretched and good blood circulation is facilitated in back bending. So back bending, twisting gives nice squeezing effect. So during the pose, it is nicely squeezed, and when you release the pose, blood gushes to the reproductive organ. So it not only tones the pelvic floor muscles, these asanas, it brings good blood circulation, which is needed for good reproductive organ health. Thank you, Divya.
Thank you, ma'am.
Thank you. So inversions are very vital for balancing the hormones. That has to be practiced not during menstruation. Other times they are all has to be practiced. So if there is any doubt, we can discuss. Yeah, any questions you can ask related to reproductive organ health.
Ma'am, excuse me.
Yes.
Ma'am, dysmenorrhea, that is painful menstruation, is it only because of lack of oxygen to the uterus, or it's due to heredity?
No, the pain is due to lack of oxygen supply. Causes we see in others. Causes are not due to this hormonal imbalance, fibroids, all this, and endometriosis. All this leads to dysmenorrhea. Why pain happens is stoppage of oxygen. Stoppage of oxygen is cause of the pain, not cause for the dysmenorrhea. Dysmenorrhea is caused by so many other reasons: stress, hormonal imbalance, endometriosis, fibroids, PCOS. All this could lead to dysmenorrhea.
From the childhood age itself, I'm having the pain, ma'am. That's why I'm asking. But I'm not having that PCOS, that problems and all.
That is what, these asanas, which enhances good blood circulation to the pelvic organ, is focused. For dysmenorrhea, even the doctors, they recommend exercising. Exercising brings blood circulation. So doing the asanas, which we demonstrated now, are very helpful for working on the dysmenorrhea, and that on a regular basis you have to practice.
Okay, ma'am. Thank you.
To balance the hormone inversions are very, very helpful. So Viparita Karni Sarvangasana, if you put Sirasasana, if you are able to do Sirasasana, it's wonderful, because it the mechanism of Sirasasana inversions, it drains the blood circulation initially, but once you come out of the pose, blood gushes to the reproductive organ. It tones the pelvic floor muscles also. So all these are helpful. You have to practice this on a regular basis.
Thank you so
Ma'am?
much, ma'am.
Yes.
Ma'am, is the PCOS and PCOD one and the same?
Yeah. Polycystic ovarian syndrome is PCOS. Polycystic ovarian disease is the PCOD.
Okay. Thank you, ma'am.
Thank you. See, the mechanism is simple. In yogic asanas, in backward bending, it stretches the uterine wall. It stretches the backward arch. In Ustrasana or Chakrasana, all these nicely stretches on the pelvic floor muscles, and good stretch happens to the anterior wall of the uterus. And in forward bend, in complete forward bend, we do compression, right? In a Paschimottanasana or Uttanasana, or the complete compression happens. So once you release the compression, good blood circulation happens to the lower abdominal area. And then in twist, the squeezing, the twist has to be so intense. It has to be, all the asanas has to be more organic, not at the musculoskeletal level. It has to penetrate deep into the organ, not just feeling at the superficial muscle level. For that, you need to be in the pose. That is why we take the support of the wall or the props, because only when you maintain for few more seconds, good blood circulation can happen. And doing independently, we may need more flexibility, or we may feel we may need more muscle support doing it independently. But when taking support of the wall or other props, we can, without straining, be maintain the pose to enhance good blood circulation to the pelvic organ. So all the, not only the pelvic organ, the asanas has to be more penetrative to the organ inside, not just at the superficial level, at the muscle level. It has to go deeper into the organ. Twisting and inversions, when it comes to menstruation and hormonal balance, inversions are very, very helpful. So that has to be practiced on a regular basis. Sarvangasana is so wonderful, but proper preparation need to be there, contraindicated for neck pain, Sarvangasana. So you have to first prepare to get into inversions. If there is much contraindication doing inversions, you can slowly prepare from complete forward bend, like Adho Mukha Svanasana and Prasarita Pada Uttanasana. All these complete forward bend you have to prepare before you get into the inversions. And Sirasasana also is variations of Sirasasana and Sarvangasana are very, very helpful. And this Ashwini Mudra is so wonderful to tone the pelvic floor muscles. So Ashwini Mudra, Moola Bandha are very, very helpful.
Ma'am, can Ashwini Mudra can be done during menstrual periods?
No, not during menstruation.
Okay.
See, just now I told, not constriction or contraction or compression to the lower abdominal area during menstruation. It has to be more relaxed. As I already mentioned, these organs are under strain to evacuate, and at that time, you are not supposed to strain these organs, which will aggravate the condition.
Okay, ma'am. Thank you.
Okay, thank you so much. Thank you for patiently listening, and thank you, sir, for the opportunity to share about the yogic practices. I'm very grateful to our principal, Dr. Ilangovan sir, for giving me this opportunity to share my views on reproductive organs, yogic practices to reproductive organs. Thank you, sir, and thank you to our Meenakshi Academy of Higher Education and Research for giving me this opportunity. Thank you all.
Thank you, ma'am.
Thank you so much, ma'am. Clearly,
Thank you, ma'am. Excellent session.
thank you, ma'am. Session.
Hello, is it audible?
Yes, sir.
Yes, sir. Yes, sir.
So today we are going to see how to frame questionnaire because it is very essential. As per our experience, in general, psychological qualities are better than or finer than physiological aspects. So as far as research is concerned, questionnaire is very, very essential concept in psychology. So you can't omit psychological variables. if you want to do on full effort. So before how to frame questions like that and all, we will see how to execute the questionnaire. Before getting into this questionnaire, I want to share a few points with you regarding primary and secondary research. What do you mean by primary research and what do you mean by secondary research? Primary research, it is conducted through self, our own. If you do an experimental research, that comes under primary research. Primary research is the first-hand data. It is original in nature, more accurate, more authentic. Mostly it will be done for experimental research or explanatory research. So do it for survey, interviews, observations. These types also we can use the primary research. At the outset, we can tell it is an innovation, new innovation. That is primary. Secondary is a little bit different. It is a kind of information, gathering information from conducted research, already done research by someone or some people. Gathering information, gathering more information from conducted studies, previous studies. You have to, if you analyze and if you come to a conclusion, that will be known as secondary research. That is desk research, what we call. You won't go to lab and you won't do. Just you have to analyze the previous research done as per our needs. That comes under secondary. That is, we have to review the articles. So many articles we have to review. It is more statistical. That's what we call it, is more meta-analysis. Meta-analysis means more statistical way. So it gives effective information and it is not original. Whereas primary, it is original. This is secondary only. So for our own purpose, we are gathering some information, that's all. So finished form, that we have to use it. So it can be either qualitative or quantitative. Cost effective also. We can save some amount of money. It won't take too much amount. So this is the difference mainly between primary research and secondary research. So primary research, the researcher conducts himself or the researchers conduct themselves. That is primary. Secondary means we are getting information, we are getting into that conclusion by analyzing the same type of research from other sources from the past. That is the main difference between primary and secondary. So I will give an example for you. So a few days back, we have seen there is a research finding on resistance training. Resistance, that is Iowa University. Iowa University, they found that resistance training would be helpful for sleep quality, sleep promotion. That was the findings, new innovation. They had done primary data, that is. So Iowa University, they had done research on resistance training and they found that resistance training would be very much useful for getting good sleep. They have done themselves. That is primary research. And as you know very well, resistance training can be used in yogic field also, our field also. Resistance training can be calisthenics, isometrics, plyometrics. Calisthenics means dynamic, like Paunamuttasana series or joint freeing exercises, like that. It is what we call colloquially warm-up activity. It is more dynamic. Isometric is static, doing one particular asana in that particular position for longer time, like that and all. That is isometric. There won't be dynamic movement in isometric. So, for example, you take Paschimottanasana. If you do traditional way, then you can do it in static. The same thing you can do so lying down like Savasana and coming back, like that and all you can do. That is calisthenics. So calisthenics is different, isometric is different. Then the another form is plyometric. What is the difference between plyometric and other two? Plyometrics, you will be adding force. That is, in plyometrics, you are doing jumping like that, jumping action. For example, Vinyasa yoga, they will do, that is also known as power yoga, formulated by Patabi Joyce. So that kind of Vinyasa yoga practice is come under plyometrics. So resistance training also applicable in yogic field also. So this is what we call primary data. I will give an example for secondary research. So a few weeks back, you come to that one article that is done in Massachusetts, University of Massachusetts. What they are telling, hitherto what we used to think, daily we have to take or we have to do 10,000 steps. Our movement should be 10,000 steps. That is the ideal concept for keeping our health intact. So far, we used to feel like that. We used to understand like that. 10,000 steps we have to do per day in order to stay healthy. So far, we were thinking like that only. Now, what the University of Massachusetts, they had done research, and they found you no need to do 10,000 steps per day. 7,000 steps enough for keeping your health intact. So they are telling, in a new research, they are telling, don't go for 10,000 steps unnecessarily. If you do 7,000 steps, that is enough for keeping your health as like the previous notion. That's what they found. So then how we come to the conclusion of 10,000 steps? A Japanese company, they invented one pedometer that tells how many steps you had done. For their company promotion, they spread the message knowingly or unknowingly to the public, you do 10,000 steps, 10,000 steps. So all will have that eagerness to calculate how many steps we had done like that. So they will buy pedometer from Japanese company. So that was the matter that we have to have 10,000 like steps like that. But hereafter, it is 7,000 enough according to University of Massachusetts. Then how they come 7,000 steps? They didn't do primary research. They had done secondary research. That is, the previous researchers done on walking, they collected all the dissertations. That is, 15 studies they have taken. And in that 15 studies, 47,471 adults, they participated in that research. So the previous research articles they gathered, 15 articles they gathered, From that 15 articles, they found that 47,471 adults, they had done primary research. That is, they were put into primary research. Now, in the secondary research, they analyzed the performance of the previous, that 47,471 people's performance, and they analyzed, they interpreted, and they come to the conclusion that 7,000 steps enough. So how they could come to the conclusion of 7,000 steps? They didn't do by perfect research, that is primary research. They collected some articles and they got information and they are placing in front of us. So that kind of research work is known as secondary research. So that you please keep it in your mind. So that is the difference between primary and secondary. Now let us come to this questionnaire. Question means collecting data. Collecting data is essential to verify hypothesis, isn't it? Because hypothesis is very essential part for our experimental design or exploratory research. So collecting data is must for us to verify hypothesis. So verifying hypothesis is the major point of experimental design that you understand that we discussed yesterday. Questionnaire is the best research tool to collect data. If you want to have data, like any other systems, questionnaire is the best tool, best part that we have to understand. It is the most widely and commonly used for data collection. It is questionnaire is mostly we are using questionnaire that is prevalent as the easiest way throughout the world. It is needed for big inquiries. If you need more number of inquiries, you ought to go to this questionnaire format. A questionnaire, what do you mean by question? Question is different from questionnaire. Questionnaire is a standardized set of questions to gain information. So the standardized, that you have to keep it in your mind. So a few researchers, they used to ask me by phone, sir, can I use my own questions like that and all? So my guide told that I can use my own questions and can be done like that, sir. They used to ask me. Then I told that it should not be, because questionnaire means it is a standardized set, standardized form. You can't ask your own questions as like. So only standardized set of questions you have to use when you take a dependent variable related to psychological concepts. So a questionnaire, the meaning of questionnaire is a standardized set of questions, whether might be 32 or 50, like that, whatever might use it for our experimental design to gain information. It is printed or typed. It can be, the questionnaire can be printed or typed. So the questionnaire is different from question. A set of collection of questions that also standardized, that will be known as a questionnaire. So there are three types of categories of questionnaire. One is postal or telephonic or face-to-face interview. Postal means we can send, but postal, it is outmoded now. We are using our own laptop and other things to get information by mail. So postal or mail can be the first priority category. The second one is we can use our questionnaire to get information from the subjects by phone. That is second category. And face-to-face, straight away you have to be seated with them and you ask in an interview form. That questionnaires can be done in these three ways. And there are two types of informations you can gather for your questionnaire. One is status studies and another one is authoritative opinion. Status studies means straight away you have to get opinion from the person, individuals. Get opinion from the individual straight away, face to face, whether it is phone or by interview, personal interview, you state subjects. That is status studies. Authoritative opinion means you have to get from employers. Is it audible now? There is some disturbance, I think so.
Yes, sir. Audible.
Okay. Authoritative opinion means we have to get opinion from the employers. You approach the employer, owner of that particular factory or some other concern, and get opinion about your subjects. That is authoritative opinion. So two kind of informations you can gather. One is from individuals and another one is from employers, like that and all. If you have any question, you can ask at the end. Then what are all the advantages of this? What are all the advantages of this questionnaire? It is very low cost. For example, if you do experimental design on genes, or if you want to do on hormones, or if you want to do the electrical transmission, that is neurotransmission, the role of neurotransmission, that you have to go for MRI scanning like that and all, isn't it? That will be costlier. Whereas questionnaire is very easiest to form. That we have to understand. Adequate time we are giving to that subjects to give answers. That is another advantage. Third advantage is there are so many advantages. The main advantages I am talking here can be used for larger samples. So in lab experimental designs, we are at the maximum, we will be having 30 or 20. Below 20, it is not advisable, I told already. It is, the samples are very less, appropriate might be. Whereas in psychological concepts, if you use purely on psychology, then larger samples you can cover. That is the plus point of this question. At the same time, we are having so many disadvantages of questionnaire, using questionnaire. There is a large gap between the researcher and the subjects. No opportunity for getting clarification. And also there is no possibility of some other to answer. Some other, instead of, we may expect X to answer, but Y may send the answer on behalf of X. So that possibility is there. And also response may be poor. Some they will send, some they won't send. So response will be different. It will be very poor. What we expect, we won't get that much. We have to struggle a lot to get our goal. So incomplete entry is also possible. So if we ask them to give 50 answers to the 50 questions, they may skip something and they will send 35 or 40 or 30 like that. Remaining 10 will be incomplete or 15 is incomplete like that. So incomplete entries, there is more possibility and less scope for discussion. Already there is no opportunity for clarification that we discussed. So we can't discuss. If the subject has any query, any doubt, there is no possibility for getting our opinion. And bad handwriting also that may cause problems for the researcher. Bad handwriting. And also it is very difficult to get inner feelings. So there is a possibility for lying. He may hide some real answers and some other answers he can give according to his will. So it is very difficult to get inner feelings. He will give answers. So these are all some of the disadvantages of the questionnaire. Anyhow, we ought to have questionnaire. That is the point. Here we are going to see some of the types of questions that can be in your questionnaire. There are so many types of questions you can frame. One is closed questions. The questionnaire that call for short checkmark responses are known as closed form or restricted like yes or no. So questions will be there. The subject will give you the answer yes or no, yes or no. That's all. Only simple form they will give answer. So that kind of questions are come under are known as closed questions. Just they have to say yes or no, or just they have to tick one box, yes one box or no one box. So do you, example I am giving, do you like yoga? So the subject will give either yes or no answer. So that is closed question. One question is known as open questions. Open question, open or unrestricted questionnaire calls for a free response in the respondent's own words. You have to write on your own words. Understand? It won't be there in the questionnaire like yes or no, like that and all. You have to frame descriptively, you have to write. That is open questions. So what is your opinion, yogi? So you have to provide greater depth of response for that. It can sometimes be difficult to interpret, tabulate, and summarize in the research report. That is different. So you have to write descriptively your opinion on that particular question. That questions are known as open questions. Now, can you tell me what is your opinion on the qualities of a yoga therapist? Can you tell me what are all the qualities needed for a yoga therapist? Yogi is different, yoga therapist is different. Can anyone tell me, unmute yourself, and can you tell me the qualities of a yoga therapist?
Punctuality.
Yoga therapist. If you want to be a popular yoga therapist, if you want to succeed in your yoga therapy field, certain qualities are the yoga therapist. Can you list down the qualities
Self-practice.
of the yoga therapist?
Number one, self-practice.
Oh, okay. Self-practice.
And punctuality.
Okay.
Clarity of thoughts.
Okay.
Sir, good evening, sir. Experience.
Ah,
Knowledge
very
come
good.
experience.
Okay. Experience.
Sir, good evening, sir.
Ah.
What they want according to the client or patient, then you have to identify what are they need. Based on this only, we do the
okay.
asanas.
Their needs to be fulfilled.
Yes, sir.
Whoever fulfills their needs, they will be successful in their yoga therapy field. Okay.
Sir,
First, patience.
one more thing is the yoga therapist should be very empathetic.
Empathetic. Okay, good.
Sympathize with them and understand their problem before they even go into the therapy.
Okay. Then any other point?
Following the ethical service.
He should have a good knowledge of anatomy and physiology.
Yeah.
Good evening, sir. There should be a careful listener, sir.
Listening.
Yes.
You have to be a good listener. Very good.
Relieving them of their pain should be the main motto.
Immediately what they are expecting, that we have to do according to their needs. Okay.
Sir,
So at the outset, what I want to tell you, tell me.
Sir, keeping the patient's data confidential.
Very good, very good. Confidentiality should be there. Very good. Then.
Good evening, sir.
Ah.
Actually, first we need counseling the patient, how they, what is the physiologically for the mentally, how the problem comes.
Yeah.
First, we need counseling.
Okay.
So
Okay.
we need to identify that. After
Oh.
that, we have to give the treatment
Okay.
for that.
Okay.
Sir,
That and all base in, that is what are all the factors affecting Shichakrama, what are all the methods, diagnosis, how to diagnose a patient, and pariksha, what are all the factors of pariksha, and how we have to give treatment. That and all basic concepts, factors, pariksha, diagnosis, a must for us. So that also comes under one of the qualities of a yoga therapist. Okay, very good. Then at the outset, what I want to tell you, 3 important qualities should be there of a yoga therapist. One is he has to be knowledgeable, very knowledgeable in the field of yoga therapy. Second is that he has to follow the principles of yoga therapy. The principles of yoga therapy he has to follow. And third point is he has to be in sattvic. So these are all the important qualities, and what you have told others, that also applicable, and we can include the qualities of a yoga therapy. So like that, if we give descriptively in a paragraph like that, then it will be known as open questions, that is answer for open questions. The third type of questions is open and closed type of questions. Both, it is a combination of open and closed. The respondent has the opportunity to respond in an alternative manner. Respondent has the opportunity to respond in an alternative manner, because it will have closed as well as open. For example, I have given here, who inspired you to get into yoga profession? Who inspired you to get into yoga profession? Father, mother, brother, teacher. You have to take anyone. If someone else, like a friend, like that and all, there is a column for other. You have to state who is the other person who inspired you to get into this yoga profession. So it has both. So this type of question, it has closed type as well as open type. That is the third type of question. Then the fourth type of question is what we call Likert scales. The respondent may be asked whether they agree or disagree to an extent to a question. I have given example. Do you agree that yoga promotes harmonious development of development of an individual? Do you agree that yoga promotes harmonious development, physically, mental, moral, social, emotional, spiritual, cultural, vital, organizational, educational, cosmic, sexual, all kind of developments, harmonious development? Yoga doesn't know how to cheat. If you do yogic practices, harmonious development will be taken place in that area of physical, mental, moral, social, emotional, spiritual, cultural, vital, organizational, cosmic, sexual, and so on. So you have to give answer. Strongly agree. Yes, I agree strongly. Yes, yoga promotes harmonious development. Simply, I will agree. No, I couldn't decide. Undecided. No, I don't agree. Disagree. Strongly. Answers will have to choose the right answer. That's what we come to understand. Do you agree that yoga promotes harmonious development of an individual? So 5 concepts will be there. You have to tick the right one according to your suggestion, according to your feelings. And the semantic differential, the same Likert scale, semantic differential. If it is useful to assess respondents' attitudes, contrasting adjectives are used. For example, I have given, after doing yoga, I feel relaxed or I will become anxious. You have to decide which is correct, relaxed or anxious. So it is our duty of the yogic trainer. If you want to give 1 hour training, at the end of the 1 hour training, the subject, the student should get relaxation and he has to go home with enjoyment, with full satisfaction. Then only we can understand that we are giving correct form of modules in that one particular hour like that. If he is not relaxed, then it is very difficult for him to make him to come regularly. That's what we have to frame a model. Many of them are doing what they are doing, giving asanas and ask them to go home. So you have to frame one module. You should have what we call, if possible, you can add kriyas or loosening the joints should be there, Surya Namaskar should be there, asana should be there, pranayama practices should be there. Finally, you have to end with meditation. Then only he will get relaxed. So this semantic differential, you have to frame the question like this. After doing yoga, I feel relaxed. He will take either relaxed or anxious. He should not be anxious. And also, not only you see to that, not only after 1 hour he is in a good mood. What we are giving that 1 hour practice should be extended to him the satisfaction throughout the day. Then only we will be feeling successful. Otherwise, we are having some lackness. So if you end the session without giving meditation, the circulatory system and nervous system will get agitated. So you please see to that you end up the session with meditation. It is very, very essential, meditation. That's what I want to tell you. Then the other type of question is known as ranking type. Ranking questions ask the respondent to place responses in order for importance. That is, he has to rank. So I gave an example. Please rank the following parts of yoga you like most in order of preference: Hatha Yoga, Karma Yoga, Bhakti Yoga, Raja Yoga, Jnana Yoga. You have to rank them, which is good or which is not correct, which you admire more, which you follow more. You give preference. As far as parts of yoga, what is the yardstick for us? Can you tell me? Whether we have to follow everything or can we follow anyone? As far as our experience is concerned, anyone can give answer.
It depends on the individual's capacity.
It depends upon the individual's capacity. Of course, Hatha Yoga is for Iyengar. Karma Yoga is for Mother Teresa, isn't it? Bhakti Yoga is for Krishna Das. Raja Yoga is for Swami Vivekananda. Jnana Yoga is for Socrates, whatever might be. But what is the final yardstick for us? How will you follow? What is the nature? What is the characteristics in following the paths of yoga?
Sir, we can mix and match depending on the person, sir.
Do you think that we have to mix? Is it possible mixing?
Yes, it is possible.
What is the general advice for us regarding this following paths of yoga?
Karma Yoga.
No. The yardstick is, if you go through the yogic literature, many of the literature tells to follow any one path. whether it is hatha or karma, bhakti, no problem. You follow one path, but when you following one path, you synthesize the other important concepts of other parts of yoga. Suppose if you want to be a hatha yogi, it doesn't mean that you should not follow other things. You synthesize it. You synthesize everything and follow on one path. That is the criteria for following these paths of yoga.
Just like one cannot travel in two horses at a time,
Correct.
it's not adaptable also.
Correct. Have one and include all good qualities of all other paths. That is the yardstick. That is the thing that we have to follow. Very good. Well done. And let us come to that next question, that is list questions. Another type. These questions allow the respondent to indicate several responses to one question. Which of the following are you interested more to do in the last 12 months? You have to tick. Surya Namaskar. Some they will like Surya Namaskar. Some they will like asanas. Some they will give more preference to pranayama. Of course, they are all preparatory practices. The will be more for some aspects, meditation. So, which of the following you are interested more to do in the last 12 months? You have to tick. So, you have to pick up. So, these kind of questions are known as, you have to list it. I give importance to pranayama. Then I will give importance to Surya Namaskar, asanas, meditation. Or I will give much importance to meditation. That too Sukshma meditation. Sula or Tejo. So like that you can give some answers for this type. Next type is filter questions. It avoids irrelevant questions, reduces the potential frustration that response may feel. It minimizes the time taken to complete the questionnaire. Have you practiced yoga in the past 7 days? Yes, no. You have to take anyone. If yes, what yogic practices did you perform? So 2 questions are here. You have to filter it. So this type of questions. You can easily see the example. Have you practiced yoga in the past 7 days? That is first question. You have to give answer yes or no. If yes, if you give, what yogic practice did you perform? That is descriptively you have to state. This type is known as filter questions. So there are many types. You can follow any type, but you can't mix. That is the important concept that you have to understand. Suppose if you frame 32 questions, all the 32 questions should have one type of question. Then you will have your own curiosity, how to construct a questionnaire. Already I told you, questionnaire is the set of questions. Standardized set of questions. That is important point. So how will you construct? Question should be simple and short. Easily understandable. You have to avoid complex nature in the questions. Questions should be arranged in logical order. It should be like writing a story properly. The pictures or diagrams you can use if you need. Avoid asking 2 questions in one question. It should be simple and short, already we covered. Questions to be presented from general to specific nature. And avoid technical terms and vague expressions. For example, if you ask a common man, we know the name called probes. But many of them, they don't know what is the meaning of probe. It is a kind of equipment, isn't it? Probe, we know what is the importance of probe. Many they don't know the meaning of probes. So it should not be like that. It should be easy to understand. So too much of technical terms we should not use, and vague expressions Vague questions also we should not incorporate. And our questions are inquiring personal details. You should not ask personal details. They will be in embraced position. So these are all the things that you have to keep it in your mind before preparing your questions. That is construction of the questionnaire. How the questionnaire should be? So the selection of paper size is ordinarily that 81/2 and 11 inches, a size that conveniently folds into standard size envelopes. At the outset, we can have A4 sheets we can use. Provide adequate space for answers. At the top of the page, the questionnaire should contain the following items: name and address of the researcher. Purpose of the questionnaire should be given. Proper instructions to fulfill the questionnaire should be mentioned. Instructions for returning the questionnaire should be mentioned. A place for name, address, and position of the respondent should be provided. These things that you have to keep it in your mind. So what we have seen so far, what is the meaning of questionnaire? What are all the ways we can get the question answers to the questions? From whom we have to get questions, answers for our questions? What are all the types of questions? How to construct a question? What are all points that we have to keep it in our mind before framing the construction of the questionnaire? Now we are going to see here how to standardize, how to frame questions in our questionnaire. So these things you have to keep it in your mind. If you want to prepare one questionnaire, if you want to invent a questionnaire, you have to study other questionnaires of the past. You have to go to library or you have to go to Google and get some questionnaires, go through the questionnaires and how the questionnaires will be, what is its nature, everything you have to understand. So study a number of other questionnaires they have done. Second point, submit to your fellow, you frame some questions and set of questions and submit to your fellow friends or students, faculty members or experts and get their opinion. Because unknowingly you might have done some wrong things. So get opinion from your closely related persons. Then after framing, for example, you are in need of 32 questions. So you frame around 60 questions and send to all your close related friends or students or faculty members or experts. Then you finalize. Suppose if you want to do 32, you have a pilot test or trial run to be done for smaller sample group. Smaller sample group should be not, for example, in experimental study, that is our primary research, we will have pilot study with 5 subjects for experimental study. Here you should not have 5. Suppose if you have 30 subjects in a group, you do your pilot test for all the 30 subjects. That is the concept here regarding questionnaire. Whereas it is costly, experimental design. So for pilot test, you are doing with 5 persons, 5 subjects. So here it is not like that. And the defects can be corrected. Again, the questions have to be repiloted. Suppose you need 32, you are sending 60, and you are getting only 20 correct. For remaining 12, you have to need. So for that, again, you have to pilot. You have to go for pilot test again. You have to go for trial run again. Then we should continue till we get to pilot questionnaire until we get its complete design. So you have to go on doing this piloting, repiloting, till you attain your completion of your aspiration of your correct questionnaire. A second administration also needed for reliability. That you have to send for some other subjects, some other persons, because same persons, they will have same answers. Right questions needed for validity. Whether your questions are right or not, that will be decided in validity. Consistency will be decided by reliability. Reliability is different, validity is different. Reliability is related to consistency. Validity is related to quality, that is right questions. So these things you have to understand. So after framing everything, you have to adapt the questionnaire to the subjects. How will you do it? You have to send 2 sets of questionnaire to all appropriately with covering letter. Before sending questionnaire, you have to get permission either from the employer or from parents. Parents means if they are children. If you do on children, your subjects, you have to get permission from your parents. If you use employed oriented persons, you have to get permission from the boss, that is the owner. A stamped addressed written envelope should be included. You are sending, you send an envelope also. Stamped addressed envelope you have to include. At the end of the second week, now you please be careful. So you are getting permission first, then sending questionnaire 2 with covering letter, 2 sets you are sending. When you send the 2 sets of question, you send stamped addressed writing envelope also, and you expect the answers. At the end of the second week, you wait for 2 weeks. If the subjects given response, no need to worry. Otherwise, you have to remind them, send one postcard, that is postcard and all, it is outmoded, you know. What you do, you send mail again and give let it be a reminder. Understand? So reminder should be done after second week or at the end of the second week. Even then, if you don't get answers from the subjects, response from the subjects, at the 4th week, send the copy of the original covering letter and another questionnaire to those who haven't yet responded. So 3 things you are seeing here. First of all, you send one questionnaire. If you get answers, if you get response, don't bother about that. If you didn't get response, at the end of the second week, you give a reminder. No need to send again the questionnaire. When you have to send questionnaire again at the 4th week, within a month, you couldn't get any response means, then you send the copy of the covering letter and you send one new questionnaire, one set of new questionnaire. Then you get reply. So this way you have to adopt the questionnaire to your subjects. Finally, tabulate and analyze the results. So these are all the concepts that you have to understand regarding questionnaire. Now, if you have any doubt, you can ask.
Sir, one doubt, sir. Sir, this seems the period given that 2 weeks and this 1 month, 4 weeks period for first reminder and then final submission of questionnaire. It seems it is postal or mail using by means of post. Now we are communicating through mail. So this much period is very much lengthy.
Sir. For mail also you give this much gap duration. Don't disturb always. Each and every day, don't remind them because they will get irritated. They will ignore if you have done. So give some time to give answer. Because they may also have some duties, some works. Whether it is mail or postal, whatever might be, the duration will be the same.
Okay, sir. Thank you.
Because, for example, as far as our scholars are concerned, we won't take fully psychological research like that. We will have combination, that is physical or physiological or hormonal or biochemical and psychological like that. Suppose if a researcher of mind for finalizing our dependent variables. So 5 to 10 years back, we will have more number of dependent variables, 12, 13. That shows our brilliance. Now, if you do more than 5, the foreign examiner will have doubt on you whether you have done on your own like that and all. So dependent variables at the maximum should be around 5 or 6 like that. Don't take too much dependent variables. And at the same time, you have appropriate parameters, risk factors according to the topic. For example, you are doing for effects of yogic practices with and without walking on selected risk factors among aged men. Like that, if you have taken topic, you include physical or physiological, biochemical, one on dependent variable each. You take BMI or BP, you take blood sugar, you take one hormonal, like that, whether it is serotonin or melatonin or dopamine like that. Then you have one psychological, that is life satisfaction or job involvement or job satisfaction. So like that, you have to take one from each. Then only it will have some balanced state. So what I ask my scholars, you go for one psychological variable. So if you want to have one psychological variable, you ought to have one questionnaire, isn't it? So questionnaire is, knowing questionnaire is a must for you, a scholar, a researcher. That's what I want to tell you.
Okay, sir. Thank you.
Any other? Okay, tomorrow is the last day for our program. So far, we used to send daily the feedback form. Those who are attending regularly and those who are regularly given certificates. So you feedback form, you don't forget to send back to us. So thank you very much. We will meet again tomorrow, the final day. Thank you.
Thank you very much, sir.
Thank you, sir.
Thank
Thank
you.
you.
Thank you.
Thank you, sir. Thank you, sir. Thank you so much.
Thank you very much, sir.
Thank you.
Thank you, sir.
Thank you.
sir.
வாழ்க வளமுடன்.
முழுக்க முழுங்காரே
Thanks
you,
a lot
sir.
and happy Ugadi also.
Happy Ugadi, sir.
Okay, thank you.
Thank you, sir. Thank you, sir.
Thank you.
Guru garu Subhakrita Nam Subhakankshalu sir, Guru garu.
Thank you.
Oh, thank you, sir.
Thank you.